Hi, everyone. Thank you so much for joining us today. I am Erin Strain. I am your 2022 St. Tammany Chamber of Commerce Live Better Committee Chair. We have a great presentation today from two great presenters, but to get us started, I wanted to tell you guys a little bit about our mission. So the Live Better St. Tammany mission is to create and maintain a culture of health and wellness among the business community and St. Tammany Parish residents through educating employers on the importance and implementation of health and wellness programs. The committee really strives to encourage more productive employees, help attract and retain talent, build staff morale, combat employee absenteeism, minimize staff turnover, and reduce healthcare costs for employers. A couple of housekeeping things today. We will ask that you submit any questions that you may have throughout the presentation in the question and answer feature located at the bottom of your Zoom screen. We will address those questions at the end. And then we also ask that you be on the lookout for an email containing the link to the recorded presentation as well as some resources. It's just going to be a great thing for you guys to be able to pass on to anyone who wasn't able to join us today. Our presentation today is called Well-Being Leads to Well Business. We're hoping that you guys learn tips and tools for identifying hunger, sharing resources, and ensuring your employees have access to this basic need so they can focus when they're in the workplace. Our speakers today are Dr. Katie Queen with Our Lady of the Lake and Ginger Kunkel with North Shore Food Bank. Dr. Queen is a pediatrician at Our Lady of the Lake Children's Health Rural Clinic in Bogalusa, Louisiana, and she's a current participant in the Food Insecurity ECHO, a quality improvement project where she's been learning best practices in food insecurity screening and referrals. She also works with both local and Louisiana state policymakers on improving access to healthy food for children in Louisiana. Ginger Kunkel is the development director at the North Shore Food Bank. And during her time with the food bank, she's developed a passion for providing access to increasingly nutritious foods and educating the community on what food donations insecure individuals and families need most. As a result of this passion, Ginger recently earned her certificate in nutrition coaching from the National Academy of Sports Medicine. Without any further ado, I'm going to turn the presentation over to Dr. Queen first, followed by Ginger. Thank you, guys.
Thank you so much, Erin. It's good to be here today. Thank you to the Chamber for having us. I'm sitting here at the North Shore Food Bank. We are live, Ginger and I, sitting right next to me. And so we're happy to give this presentation jointly. So I'm going to go ahead and share my screen. All right, so we'll get started. So my part of the presentation is going to be discussing food insecurity in families with children, but I sort of want to take a step back and sort of talk about most of what I'm going to say relates to adults as well. And you may not have children of your own, but you may be a grandparent, you may be an aunt or uncle, or you may not have children, you may have pet children. And so all of this information applies really to anyone that's listening today. And again, that's myself, my family. I reside in Covington. I do work in Bogalusa. I'm also board certified in obesity medicine, and I do a clinic for children with obesity in Baton Rouge at the Children's Hospital, Our Lady of the Lake Children's Hospital. So we're going to jump right in and get started. Our first objective is to talk about what does food insecurity mean. I remember when I started working on this sort of topic, I was part of as she mentioned, I was part of a quality improvement project with the American Academy of Pediatrics. And I talked to my nurses. I said, hey, we're going to screen for food insecurity. And my nurses looked at me and they said, you're going to ask kids if they're insecure about food. And so I think there's a big misnomer about what that means. So let's get into the details. So first, it's important to know what is food security. So food security is when you have consistent, dependable access to enough food for active, healthy living. In other words, you don't really even think about it or worry about food and having enough healthy food. Food insecurity is when you have your access to adequate food is limited by either a lack of money and or a lack of other resources. And that may be housing or transportation to go get the food and other social determinants of health. But what's important to know is that food insecurity does not always equal hunger. There's sort of two areas that we look at as far as if a household or a person has food insecurity, we kind of separate it into either low food insecurity, which is when they have reduced quality, variety, or desirability of the diet. What that means is like they may have food, but it may not be nutritious or healthy food, but they have enough. They have enough quantity of food, and so they're not necessarily hungry or hangry, as we say in my house. And then there's very low food security, where they don't have enough food to actually get by through meals, and they actually have to reduce how much food that they eat. And so you can sort of think of it as someone with low food insecurity is just sort of stressed and worried a little bit about food, and someone with very low food security or very low food insecurity is sort of hangry, hungry, and very stressed. So what is the incidence? So why were we even talking about this in 2022? So this is based on a survey of food insecurity in US households in 2020. The newest data is not out yet, and I would venture to guess it's going to be higher. But currently in US households, the average is about 10.5% of households have food insecurity. And as you can see, most of those are low food insecurity, and then a small percentage are very low. What about if that household has children? Do you think that that makes the incidence higher or lower? I know y'all can't answer me, but the answer is higher. So it actually increases, and it makes sense. You have more mouths to feed. And so in these households with children, or let's say grandchildren, or if someone is taking care of someone else's child, that incidence goes up to almost 15%. And the scary part is that we know from some preliminary studies that this is increasing after COVID. So the current estimates are anywhere from 14% to up to 25%, which is 1 in 4 households are dealing with this issue. And this is just another statistic: 1 in 7 US children live in households with food insecurity. So if you think about who's at your office today. You're in your office, or maybe you're at home, but think about your employees. Let's say you have 10 employees, at least 1 out of those 10 is going to have some food insecurity, just based on statistics, and probably more than that. So this issue really does affect employees, employers sometimes. It affects everyone, but it doesn't affect everyone equally. And it's no surprise that Black, Hispanic, Latino families or adults experience more food insecurity. If you're in a rural area, higher rates of food insecurity. Households with children, as I mentioned, if you're a single parent, if you're an immigrant, if you are Native American or Alaskan Native, or you have a household member with a disability. And so this may just make you think a little bit more about that 1 in 7. It might be more like 1 in 5 for any of your employees with any of these risk factors. And food insecurity does really highlight the inequity. And you can sort of see, this is the trend. I like this map because you can see the trend of food insecurity from 2001 to 2019. And you can see that the blue line is for Black non-Hispanics, and their percent of households with children are up to as high as 30 to almost 32%. You can see, whereas our white non-Hispanics, which is that lower line, are only experiencing maybe 10 to at most, I'm seeing 16%. That's a big difference. And then if you look at the Black dotted line, you can see that in 2006 to 2008, we had a large spike in food insecurity in the United States. And that sort of held and started to go down. And now this graph doesn't show that we are in the next spike. So you can sort of think of it as the COVID spikes, but basically we are on the uprise. For the next graph is going to show a big uprise at the end of this. So Louisiana, unfortunately, has the 3rd highest rates of food insecurity in the United States. Mississippi and West Virginia, they always beat us. Interestingly, we are also 3rd in the United States for childhood obesity. So that's a stat that I have stuck in my mind, but we are also third highest for food insecurity. So this is a topic that we need to be talking about. Business owners, this is an issue that your employees are experiencing. So why does it matter to business owners, especially maybe if you don't have children? Well, it's because we know from studies that children with food insecurity are sick more often. We know they recover from illness more slowly. They're hospitalized more frequently. And this was just based on my research as a pediatrician. But if you look up the data and the research, the same is true for adults. Adults with food insecurity are sick more often. They have less nutrition, which means less immune system that's working to fight illness like COVID, like the flu. So they're going to miss work more often. They're going to call in to work more often. They're maybe going to come to work, but they may be not all there because either they're hungry or they just don't feel well. They're more likely to be hospitalized, and they're more likely to utilize healthcare resources, which does affect the bottom line for a business. And so it is directly linked to the health of the people experiencing food insecurity. So I hope that sort of gave you an idea of what is food insecurity. And now we're going to talk briefly about how do we screen and identify who has food insecurity. This is a really important point, is that you cannot just look around your office and sort of say, oh, well, this person's clothes look a little bit, dirty, or this person, looks like they're sort of stressed out, so maybe they have it. You cannot sometimes tell. So if we don't screen or we don't ask, they probably won't tell, and you can't tell just by looking. And that's true for children, and that's true for adults as well. I've been really surprised. I started to screen for food insecurity in my office about 6 months ago, and I was really surprised. Some of the patients that I did not think had issues with food were the ones that screened positive, and the same is probably true for your employees. So there is a screen that we use in our clinic called the 2-item hunger scale, and it's based on an 18-item household food security survey the Department of Agriculture does every year. And so I just wanted to point out that this is a very good scale and screen, and you could utilize it in the workspace. It doesn't have to be just in a clinic, because it's very sensitive, 97% sensitivity, which means it's not going to miss many people, and it's pretty specific. So that means if it's positive, that means that it's probably true that they do have food insecurity. And so what does that hunger vital sign look like? There's 2 questions, and I want you just to think about, visualize yourself maybe asking this casually to someone, or you could print this out and you could just have it maybe in a newsletter for your employees. Within the past 12 months, we worried whether our food would run out before we got money to buy more. Is that often true, sometimes true, never true, or don't know? So did you worry whether your food would run out? So just that worry is a positive. And within the past 12 months, did the food that you buy, the food we bought just didn't last, and we didn't have enough money to get more? And so that sort of gets at that very low food insecurity, where you're not able to buy enough, and so you do have to sometimes go hungry. And so this is something you're welcome to download and use. We're happy to share our slides. It's very, very important that if you are going to utilize the screen, or it's very important to normalize it. And so this might be how you might present it. And this is how I say it in my clinic. I'll say something like, we've really noticed that after COVID, food prices are significantly higher and they're increasing. And so we're asking all of our patients, or you may say, we're asking all of our employees a few questions about access to food. And we wanted to also provide some community resources that are free and might be useful to you. And so sort of normalizing that we're doing this for everybody. We're not screening only people that we think have it. We're screening everybody in our business. So that's one idea about screening. And let's move on to the final section, where we're going to talk about connecting families to resources. So if you have a positive screen, or you've come across an employee that does experience some food insecurity, if they have children, there are several programs that they often will qualify for. Not always, but I just wanted you to be familiar with some of these federal nutrition programs that are already built in and available to many people. And so we're just going to go real briefly through, and then I'm going to pass it over to Ginger. We know that these federal nutrition programs there's science that shows that they actually help. They have reduced food insecurity. They have helped lead to better health outcomes. What that means is improved academic achievement, healthier eating, increased in family economic security, and it stimulates the local economy. And actually, sure Ginger will mention, but some of these programs do work with the food bank. And so let's talk real briefly about WIC. WIC is a program, just to be aware of, that if you have a child who is age 0 to 5, then oftentimes the family would qualify for WIC. And of course, there's different income levels. If they are on Medicaid, they automatically will qualify, but this will offer fresh fruits and vegetables many times, some milk, some dairy, some different food each month. And now what it is it's an EBT card, and they get to go and swipe it at the store and buy things. They also have breastfeeding support and other things like that. SNAP, you've probably heard more often. That used to be called food stamps, and now it's called SNAP. That is available it's more for an adult, and based on how many children in your family, you may have higher benefits from SNAP. And again, if a family or an adult has Medicaid, they often will qualify for SNAP, but it's a little bit more complicated than that. So you can always help them go to the SNAP website to learn if they qualify. And that's also a card that they can have and basically go like a debit card at the grocery store. Some farmers markets are actually accepting SNAP, which is pretty neat. And then there's the National School Lunch and Breakfast Programs. You've probably heard about that. This year, at least in Louisiana, if your child or a grandchild goes to a public school, they're getting free breakfast and lunch, and including my children, which is nice. And then there's the child and adult care food program. So if you have families that are in a Head Start, an early Head Start, or a child care center, or a group home sort of place, adult group home, then they can qualify for this special feeding program. After school nutrition programs are great. I think that Ginger is working on something similar to that for helping kids after school. So we know that the school food is great, but when they go home, what are they eating and what do they have? So this is helping with that. And then you've got summer nutrition programs, which are a big deal because we know that children's weight often go up in the summertime. And so having access to healthy, nutritious food in the summer is really important. There's fresh fruit and vegetable programs. There's emergency food assistance programs. And I think that was the end of the federal food programs. I just want to highlight just 2 or 3 more things before I pass it on. And I don't know if you've ever heard, but a food pharmacy is sort of a new trend. It's really popular out in the West, but this is where a doctor like myself would refer to a food pharmacy. And I would love, maybe we can work with a food bank. I have this on here, partnering with a food bank to develop a food pharmacy. And what that means is, let's say I have a patient with prediabetes or hypertension, and then which is high blood pressure, I may actually prescribe a specific food box or type of food plan for a patient, and then they go to the food bank and fill it out based and they get food specific to their health needs. There's one example called ProMedica in Ohio. You can go to their website. It's pretty neat. And then there could be a food shelf. If you're a business, you could have a food shelf at your office. This is pretty cool. You could partner with a food bank like North Shore Food Bank, and you could have some fresh fruits and vegetables, maybe some non-perishable foods in your office, and offer it to your employees or offer it to some of your customers. And you could distribute it through food drives as well. You could collect food drives. And then finally is the produce prescriptions. This is something I just wanted to mention because I'm about to do this in my clinic, but we are working on giving out prescriptions. So patients who qualify are going to be able to get boxes of fresh fruits and vegetables monthly for 6 months, and also a debit card. And so the point of all of this is really just to say that there is a lot out there. There are a lot of resources, but if you're not screening, you're not thinking about it for your employees, you may be missing it. And if you have that employee that just always seems angry or stressed or just not getting along with the other employees, or maybe they're not showing up to work, they're late, it's always important to take a step back and think about, like, maybe there's something under the surface. Maybe there's something deeper that's going on. Maybe they don't have the basic human needs that used to be easier. And now after COVID, everything's more expensive, and having to feed their family might be part of the issue. It might not be, but it's important to at least be aware of this issue. And so this is just a food resource referral page. And when in doubt, you can always refer somebody to 211, which is great. And they connect you to any resources for food. And so the next steps are in your office to identify a hunger champion. So if you are the one listening to this, I would suspect that you might be that hunger champion in your office. But if you have someone who is sort of interested in this topic, label them as the hunger champion in your office, and share this webinar, please, with your office staff, and consider implementing screening. You don't have to, but it's something to consider. Consider just giving resources to everyone. We are going to offer some resources in the chat box, and maybe posting like an infographic about food insecurity might be an idea. It's important to know your local food bank. Feeding America is a website where you can put in your zip code. And for this area, St. Tammany Parish, it's going to be the North Shore Food Bank. And it's important to maybe just stay up to date. For example, you can join the Second Harvest Food Bank listserv. And you can also, if you're interested in children, you can join the No Kid Hungry listserv. And so these are my references. And please, if anyone has any questions regarding children's health or food insecurity for children and families, y'all are always welcome to reach out to me, katiequeen3@gmail.com. And thank you so much to the Chamber for having me. And I'll be available for questions at the end. So I'm going to pass it now to Ginger. If I can change our slide, let's see here. All right, Ginger, so we're going to go to here. All right, how's that? There we go.
All right. Hello, everyone. So I want to thank Dr. Queen for being here with me today and bringing some great, oh, where'd my presentation go? Oh, here we go.
Share your screen again.
Hold on, technical difficulties. Here we go. Okay, now we're back. She's got some great ideas and statistics, and there's a few things that I'll reiterate because I feel they're very important, but also to give some perspective of what I see by working here at the food bank. So I'm just going to cover understanding food insecurity. Whoop. Okay, so the first thing I wanted to bring up was Maslow's hierarchy of needs. So the reason I want to bring this up is we as a food bank, and most food banks you will find, they will say part of their mission is to provide access to basic needs. And that is indeed what we do here at North Shore Food Bank. So food, water, shelter, warmth, those are all at the top of that list for your basic needs. That builds the foundation. If you don't have your foundation, how are you going to move up that hierarchy and feel like you can concentrate at work, focus on your work, focus on your family, focus on your friends, do the things that you need to do when you don't have that food, that water, you're constantly worrying, you're stressed out, you're not going to be able to move up that hierarchy. So that's just something that I like to bring up. I really enjoyed these quotes from Hippocrates. I'm sure I know Dr. Queen's familiar with the Hippocratic Oath for sure. That this is the Greek father of medicine. I'm sure most of you know, but I just love both of these quotes. If we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. And then, of course, let food be thy medicine and medicine be thy food. And food is indeed medicine. Dr. Queen already talked about that, but if you don't have enough food, it's going to affect your mental health. You're not going to be able to focus. You're not going to be able to think at work. Same for kids at school. I mean, we see this all the time with kids that lack focus at school because they're hungry. And you're likely to suffer from chronic disease, type 2 diabetes. We here at the food bank see that as an ongoing issue, heart disease. You're just at a higher risk in general. So it's very important that people not just have food, but they have enough and the right kinds of food. So what is food insecurity? I know we already touched on this, but it's very important to know the differences. I'm going to break it down a little further from a food bank perspective here in a moment. But the USDA defines food insecurity as a lack of consistent access to enough food for an active, healthy lifestyle. So hunger is a feeling. It's an uncomfortable feeling. We've all experienced it. I'm getting a little hungry right now because it's lunchtime, y'all. But there's a difference between being hungry and being food insecure. If you're food insecure, you might have food, but you might not have access to the right kinds of food or enough food. So you might be eating, instant noodles. You might not have any fresh fruit and vegetables, meat, produce, dairy, things like that. You might have the all well to known college favorite of ramen noodles to sustain. I've heard stories of parents that give their kids soda, not because they think the soda is good for them, but because not only is it cheap, but they feel like the carbonation helps keep them full. So there's kinds of things you got to think about. So this breaks down food security and insecurity and two different levels, which we talked earlier about low food insecurity and very low food insecurity. But from our perspective, when you break it down in terms of the kinds of populations, very low food insecurity usually are people that are going to qualify for supplemental nutrition through the USDA through this federal programs, and they're going to meet that 130% or under of poverty guideline. But then you have people that have low food security. So those are the people that are living paycheck to paycheck. They have food. They might have some consistent food, but it might not be the right kinds of food. There's no variety. There might not be any leafy greens. There might not be any meat or enough meat, or it might be cheap meat, things like that. And so that's where I want to bring up what we call the ALICE population. This is a term from the United Way. ALICE is your asset limited, income constrained, employed individual. So these are your working class people. These are people that are working paycheck to paycheck. And if they have a medical bill, if they have a broken down car, if they have any kind of major issue that they didn't expect, that might bring them back and down into that poverty cycle. So these are people that are living on the edge of poverty, and these are the backbone of our society. These are the people, as they pointed out, and this picture that I pulled up here, where they're giving the example of the schools. Alice could be the custodian, the bus driver, the crossing guard. These are people that are running your schools. These are people that are working as in a variety of positions. These are people that are getting your trash. These are people that are fixing your cars. These are, people that are coming to work on your home. So think about that. These are people that are just right there. It could be you, could easily be one of your employees. And in 2020, and Alice report on 2020, a third of Louisianans fell into this category. In St. Tammany Parish, 32%. So nearly a third in St. Tammany Parish fall into this category of being asset limited, income constrained, and employed. And it's growing, and it's going to continue to grow, especially as we see things like inflation. So this is just something that we recently put out actually on one of our appeals. And the reason I wanted to bring it up is because this gentleman is a mechanic. So I actually talked to him. He came to the food bank. His friend brought him because his wife is sick. She's suffering. He's taking care of her. He hasn't been able to find a job since COVID. He was a mechanic for 30 years. He doesn't know how he's going to feed her or himself. He can't afford to put gas in his car, let alone get insurance, which is why his friend brought him. He didn't want to drive his car that's uninsured. He wanted to be responsible. His friend brought him to get help from us. So that is just something to really be aware of. It could happen to anyone, and you could be in this kind of situation. So we do offer a program for that here. I'm not going to get too much into our programs, but we do offer something specifically because we were inspired by what was going on with the ALICE population when we learned about it. I believe we started this program, I want to say it was in 2018, for people that meet those qualifications that are part of the ALICE population. And I'll get into that in a little bit more detail. But for people that make a little too much to qualify for SNAP programming or any kind of federal program. But what I do want to show you here is food insecurity income levels, because to me this is pretty mind-blowing. This always sticks in my brain, and I just wanted to pull some examples. So to me, the one I really want to show you is if you look at a family of 4. So think about 2 parents, 2 kids, and to qualify for SNAP, to get that supplemental nutrition from the government, they have to make below $36,075 to qualify. We have a program that is for people that are at 200% and below, between that 130 and 200. For us, that's the ALICE population. Now, to back that up a step, the ALICE population is not qualified based on an income threshold. The really cool thing about what United Way did is they did it based on what people are paying for, what their expenses are. So they're looking at averages, what the average pay is, but then what your average bills are, your child care, your homeowners, your house, your car, all that kinds of stuff, to determine if you would be in that ALICE population because of the realistic amount you'd be paying for your bills. So we can't easily do that here at the food bank. We can't take every person and go, okay, well, this is how much you're paying for these bills. This is what your income is. So you qualify for our programming. That would take a lot of legwork. So instead, what we did is we bumped up a threshold for the ALICE population that comes here, where they're in between that 130% and 200%. So if somebody comes in our doors and they make more than that $36,075 and they're a family of 4, but they're under $55,500, we could still provide some assistance to them, where we're actually giving them food that we purchased or that's donated by the community, and not coming from USDA food that we might receive through Second Harvest, who is a federal agency. So just to explain that really quickly, we get about 1/3 of our food from Second Harvest, and since they get it on a national level from the USDA's Feeding America network, that is why we have to utilize those SNAP income guidelines. I know that's a lot of information, so at the end you can definitely ask questions or email me, because it is a little confusing. So how does this really relate to food insecurity in the workplace? Well, if you have people at work that can't focus and they're sacrificing their nutrition, that can lead to poor physical and mental health. They can't think. How are they supposed to work properly? How are they going to operate heavy machinery, or safely get kids across the street if they're a crossing guard, or teach your children, or work at the grocery store and effectively give you the right amount of money back? I mean, all the little things. If you can't focus, it's going to be really difficult to do. Struggling families have to choose between a lot of things. There's a lot of tough choices, and that's going to add stress, and that stress might be brought into the workplace. If you're struggling to choose between paying for something for your kids at school, or paying for their food, buying school uniforms, paying for the air conditioner to be on, or paying for the heat to be on in the winter, putting gas in the car. If they have food, that's one less concern, but that often people have to choose, and they may have to skip meals in order to provide for the family. And that, like I said, that's going to be stressful. There's going to be lost productivity and a lack of focus in the workplace. So you might be asking yourself as an employer, well, we pay a decent wage. How could I have food insecure employees? Well, if they have overwhelming medical bills, unexpected costs, their car broke down, like I was saying with the ALICE population that we see, if your car breaks down, it can be pretty expensive to fix. If your transmission goes out, brakes go out, medical bills can be overwhelming. Changing your family dynamic, say the mother-in-law moves in, or you've got to take care of a sick family member. Kids are having some medical issues, or could be going through a divorce, having to move in with somebody, or somebody else in your family is going through a divorce and they're moving in with you, and that's more people to feed. And then inflation, guys. Inflation is a huge problem right now. We're seeing more people come through our doors as a result of inflation. I love the idea that Dr. Queen brought up earlier when we're talking about the stigma, which is something else I'm going to get into in a minute. But by saying, hey, we recognize that groceries are so much more right now. We just want to provide these resources to you. It's a really nice way of reducing the stigma and letting your employees know that you're here to help, and here's some resources, and opening that door, because that inflation is affecting not just the groceries, but the gas to get anywhere, including work, your homeowner's insurance, your air conditioning. If your electric bill is really high and you also have to buy groceries, that can be a huge struggle. There have been some crazy shortages that have resulted in higher expenses for a lot of food items too. Eggs and chickens, because there was, I think it was a bird flu breakout, if I recall correctly. And you might be wondering why you weren't seeing as many eggs in the store and chicken went up. It's because there was a chicken shortage because of that. Or no, maybe it was salmonella. I'm sorry, I think it was a salmonella outbreak that happened. So there's all these different little things that can affect the food costs, and then that's going to impact people, and they may not be able to get their food, or they might be really surprised when they go to check out of the grocery store and their bill's way higher than they're used to. And then they have to make some tough decisions or max out their credit cards. So I always say this when I'm doing presentations and I'm touring people around the food bank: you can't pour from an empty cup. I really love this phrase because I think it's just a way to just really envision how someone's going to feel if they're stressed out physically, mentally, they're tired, they're hungry, they're trying their best, but they just can't keep it all together, but that cup is empty. So we hope here that when we're helping people with some food assistance, we're putting a little bit of coffee back in that cup, or tea or water or whatever it needs to be, helping them get that focus back and being able to do what they need to do. So this is some information from Feeding America, which is going to be on that resource list that you have for St. Tammany Parish. So this shows you the numbers here for St. Tammany in terms of the food insecure population. So 43% of, well, let me back up. Almost 12% of St. Tammany Parish is food insecure. Out of that, about 43% of that, nearly 12%, falls under that SNAP income guideline. So those are people that will that qualify. They're truly low food security and qualify for programs. And then 17% of that fall between the 130 and 185%. So they're going to qualify for WIC, but they're not going to qualify for SNAP if they meet the other qualifications for WIC. And these are also people that could qualify for our Feed the Gap program, which is for the ALICE population here. And then that 41% above that is over that 185. It might be over that 200% that we use, but they are more of that ALICE population, living paycheck to paycheck, that aren't quite making ends meet. But let me tell you, out of that 12% of people in St. Tammany Parish that need help, only 12% of them are coming to the food bank. So 12% of the 12%, that's a really small number. And I recognize that there are other food pantries in St. Tammany, but we are the only one that is the long-term continued assistance, meaning that when you come in and you qualify for our program, you're good with us for a year until you register. Most of the other pantries here, it's a one-time thing or it's short-term. It might be a month, it might be 3 months, but they might offer other services like emergency bill pay and things like that to help them. We are long-term. So why out of that 12% are only 12% coming to us? Well, stigma is a huge issue. We are in the second richest parish in the state, and people are scared to say, hey, I need help. They don't want to ask for help. They don't know what to do. They don't know how to process that. There's a lot of pressure. There's that, there are kids that are reluctant in the school system to take free food because of how it can be perceived. I've heard countless times from caretakers that they have people like veterans that they are serving, that they're taking care of, and their pantry's empty, the refrigerator's empty, and they need help, but they don't want anybody's help. They don't want your pride. They don't want your assistance. There are college students. I've heard stories from different schools where they have these students, adult students that have kids, and they hold on and they hold on, and they're living in their car and they're going to school and they don't have anything. And one particular story that someone shared with me, they had that happen, and the only reason they found out is because the security guard called them because they had the student that needed food, and they also needed a place to go because the hurricane was coming. This was right before Hurricane Ida. And finally, they still weren't going to ask for help, but that security guard was like, no, that something needs to be done here. Let me just call a school counselor. So people really, truly do hold on and wait until they can't do anything. So we got to find ways to erase that stigma, to make people feel comfortable, to normalize that conversation. So like I said, that the stigma and then the pride and the pressure, those are big parts of it. Transportation issues. St. Tammany Parish does not have a regular public transportation program. We don't have buses. You just see like the Coast Bus and a few other programs. Uber is expensive for a lot of people. I live in Lacombe. If I want to Uber, I'm gonna have to wait an hour and pay $60 one way. So I'm not going to Uber anywhere. And then the lack of education about the resources and the services that are provided. People may not know that it's an easy process. If you have the information coming to us, we've worked really hard. I can't speak for every food pantry and every resources out there, but we have worked really hard to make sure that we have volunteers and staff here that are trained, that will make people feel comfortable, that they're kind, and that they will understand that they're going through a difficult time. And time and again, I'm really proud to say that the feedback we get from our participants is that they appreciate the treatment that they receive here from our volunteers. And just knowing what the resources are, you might need food, but you might not realize where you can go for it. And there's not just us, there are places in Slidell, Pearl River, Lacombe, other places in Covington, Mandeville. If you have employees that live in a different parish and they're not in St. Tammany, but you work in St. Tammany, there are resources in Washington and in Tangi. You can call 211 to get some resources. There are church pantries and there are churches that will provide and help people. And there are lots of resources that we can give you. 211/Violink is a great resource. But there are also lots of other ones that I've done my best to provide some that I think will be helpful. But I'm absolutely happy to help if someone has a question. If I don't know and I can find out an answer, I will, because it's important that you know the resources that are applicable to the people that are working for you and with you. So just to quickly move into developing your strategy to assist those people, what could you do? Provide those resources, share this information we're giving you, offer some classes that might help reduce some stigma. You could do some lunch and learns about different resources in the community like Violink, or have the LSU Ag Center come out and talk about healthy eating on a budget if you recognize there are budget constraints. They do a wonderful program on how to budget. United Way Prosperity Center does a wonderful class on couponing. They also do financial capability classes, and I'm sure they'd come out and talk to people. They do a lot of services like free taxes for people that qualify. Have a snack area that might help reduce the stigma. It could be take a snack, leave a snack. People could contribute snacks and people could take them. And if it's just anybody can have anything, then they won't feel like it's weird for them to go take one. But please encourage stocking healthy snacks, apples, protein bars, not junk food, but things that might be filling, taking into consideration that you might have employees that truly are food insecure and they might already be purchasing inexpensive things that aren't filling. Train your HR and management on these tools to help struggling employees. Understand the effects of cutting their hours and what they might do to implement the screening that Dr. Queen was talking about. That vital sign screening is a really great tool. If you can utilize this one of our PowerPoints, you can also Google it and find a lot of information about the vital signs of hunger, and implement that, or at least provide it as a resource. Be supportive and have an open door, and that might help your employees if they're struggling. And then just normalize that conversation. Again, like we were talking about earlier with the cost of food rising, and just saying, hey, we recognize there are some increases, so here's some information, some helpful tools. And between doing that and having a snack area, I really think you're helping reduce stigma and normalize that for people. So here's some of those resources I was talking about: 211, United Way, Second Harvest. So they do have a pantry locator on their website. So if you have employees that live outside of this area and the ones that we were talking about, they can go on and find some place that's close to them, find out the information like their hours. There are a growing number of community gardens, and there'll be more information about this coming out. Covington Community Garden just opened up. It's really cool. I'm sure there are some other gardens. There's another one in Covington, and I think there's some other places that are putting forth efforts to have community gardens. I know Samaritan Center in Mandeville has one that's probably specific to their participants, which is awesome. And we also have one here specific to ours that we just started and just pulled our first batch of cucumbers from. Blessing boxes are all over the parish. That's where you can leave non-perishables, but also take non-perishables. You can go on, there's a Helping Hands St. Tammany Facebook page, and that's where they list them. Covington Community Garden, I don't know why that's a tongue twister for me, does have one that they just placed there as a part of their grand opening, which is pretty cool. But they're all over the parish. I've seen them on the Trace. I've seen them in Old Town Slidell, seen them in Mandeville. So check that out. There are some hot meal locations. There's not a lot of those. There's more on the east side of the parish. But there are some opportunities to send information on that. And there's a huge one in Tangi. If somebody lives in the Hammond area, Our Daily Bread, in addition to being a food bank, also does meals. There are churches here like Hosanna that do hot meal primarily for the homebound, but that can provide information. Provide access to people to be able to register for programs, give them a little break to go on the internet and do that, give them that permission to go fill out that SNAP to see if they qualify online, or to go to that SNAP appointment if they want to go do it in person. And like I said, the vital sign screening, utilize that, have that as a tool, and the food prescription concept. So, Dr. Queen talked about that. There's also a lot of Medicare programs that will do that, where they actually just have like a little slip book that says, okay, after they ask them those questions and they recognize they're food insecure, they refer them to the closest food pantry. It can be something as simple as that, like, we recognize you're food insecure. I mean, you probably want to put it in a different way after you talk to them about the vital signs, but you know what, here is a resource. We have a Get Help flyer that shows our process that we can provide. We also have one that I created, feeling that it would reduce the stigma a little bit. It has both getting help and giving help on it. So somebody doesn't feel like people are watching them if they take information on getting help, because it's information on getting help and also giving help, but then it gives them that information on what to do if they need food from us. Offer those classes. Like I said, another one that I talked about, the lunch and learns, couponing. I got a little ahead of myself, but also if you provide screenings on site, health screenings, like the Be Well bus or START has some great clinics. You never know, though, by going through those screenings, they might ask them some questions and identify food insecurity and give them some information and some resources, and in a way you're helping with that. And having that snack area, like I said, make sure you have filling stuff. I'm just really good at getting ahead of myself in these webinars. I apologize. And having those screenings and make sure that you're open and you're communicating and you're working with your employees, and everybody's working together to provide those incentives and flexibility, so they feel like they can go apply for SNAP online. They feel like it's okay to ask for help. It's okay to take that snack. And then, of course, support your local food pantry, because that's important. That's another way you can help. So I just want to give you a quick lesson on what food pantries need in general. So not just us, but most food pantries. So what is a food pantry? And I keep saying food pantry, even though we call ourselves North Shore Food Bank, because technically we're considered a food pantry. Second Harvest is considered a food bank. They're more the distributor. Think of it as the warehouse the food is coming from, and it's coming from the warehouse to the pantries. They actually deliver to over 700 food pantries. That's pretty huge. We are direct to our participants. We both on-site and off-site. We do deliver to some people off-site through some programs and through some volunteers to homebound and to other nonprofits. But the bulk of what we do is serving individuals and families directly. So put simply, a food pantry is a place for hungry families to receive food. Most of us use SNAP income guidelines because we're getting a good chunk of our food from someplace like Second Harvest, which means we do have to qualify people according to the SNAP income guidelines and those thresholds, that 130% that I showed you earlier. But food pantries have a lot of different programs. Every one of them is different. We started a weekend program for one school, and if we have grant funding for it, we hope to grow into other schools in different areas in the parish. They might be getting free meals at school right now, but where are they getting that food on the weekend? For our participants here, if they are out of school for a holiday or for the summer, we also have additional food for that. We provide a Thanksgiving meal. A lot of food banks, including us, do have special dietary boxes, like a type 2 diabetes box. Some might do a gluten-free box or things like that. Provide fresh produce, provide some emergency bill pay. We don't do emergency bill pay, but there are some that do short-term that also do emergency bill pay and help with SNAP registration. We're hoping to get to that soon. It's a little bit of a process, but we're hoping to be able to help people SNAP soon. In rural areas, there's a lot of barriers to access, so food pantries might be doing mobile distribution. We just started one in Folsom. It just kicked off last month because there is a great need in Folsom. It is a rural area, and there are needs in the area. It's what you can call a food desert, which means they might not have access. If they can't get to a grocery store and it's too far away, they might be very limited in where they can get their food and how they can access it. So there are a lot of mobile distributions opportunities, a lot of pantries that do things like that. And then pantries are also trying to provide healthier things. It's not just us, it's During the pandemic, we really saw more of this focus. It was really exciting. You get a lot of the produce through the TFAP program, as well as the dairy products. But a lot of us are shifting to where we are purchasing produce and growing gardens to ensure that we are giving healthier items to our program participants. So what do food pantries want? Well, food pantries want in-date, unopened, nutrient-dense items. We do not usually want expired food because there's too much gray area involved in that. There is actually not a rule out there about best by, sell by. What the USDA does not put out any rulings about what's safe and what's not safe to eat in terms of expiration dates. The only hard and fast rules come down to baby formula. That's it. That's the only one where they have a specific rule. So for us personally here at this food bank, and every food bank's a little different what they'll do, we remove the gray for a couple of reasons. One, it's a lot easier for our sorting volunteers to make a determination on what's good and what's not good by looking at dates. The other reason that we do that is the dignity. So it's already a struggle to ask for help. There's already a lot of stigma. We're already in the second richest parish. We want people to feel like they're almost in a grocery store shopping experience. We want them to have in-date food that's as new as possible. I mean, if you went to the grocery store and you bought something and it was expired, would you take it back? Would you be upset that you bought something at Rouse's and it expired a year ago? What would it make you think about that Rouse's that you went to? So we want to do the same thing here. And making sure we're donating those healthy items that they need, low sodium veggies and sauces. We don't really want the high salt stuff, you know, fruits and juice and not corn syrup, whole grain cereals, pasta, brown rice, you know, canned tuna and chicken, nut butters, kid-friendly, easy open items, fresh produce, meats, dairy. You know, we'll take your garden produce, we will take your chicken eggs, and of course, water is a good thing too. So these are all things that we always want. We also like to have prepackaged meals for families. And by that, I mean, for a family of 4, you know, we don't want big bulk things. We can't process it. We don't have USDA white rooms for that. And most food pantries that are smaller don't. Second Harvest is a place that would, but we would not. Fresh bread, cleaning products, you know, those are expensive items that people are looking for, especially, you know, your toilet paper and paper towels, sanitary items. You know, we do take things like adult diapers, baby diapers, toiletries, ladies' hygiene products, pet food. People with pets, they will feed their pets before they feed themselves. So we will absolutely take pet food, electrolyte drinks during the hot summer months, spices and condiments to pep up those canned items, coffee and tea, things like that. But what we don't want, like I said, we don't want the expired items. We don't want broken or open items. We don't want the jam that grandma made because we don't know how she canned it. We don't want the cheap stuff and the instant noodles because that's what they're already buying, guys. If they're already buying that cheap stuff, we want to give them stuff that's going to help them out that's more nutritionally sound. The reason we don't want large bulk items is if we're making a box for a family of 4, we can't fit that giant can in there. We need to be able to fit all 18 staple items that we have, or another food pantry, however many items they have that go in that box. They need to have room to put that in there, and large trays of food that we can't separate. So needs can change based on demand and shortages and inflation. It always changes. So always ask if you're about to do food drive, hey, what do you need? And any food pantry would be happy to tell you what their current need is. So I have a little list of resources here, but we're going to send that out into the notes. So you'll be sure you have some direct links for all of this. And then if you have any questions, here's my contact information as well. But like I said, this will all be sent out. And now I think Erin's going to open it up for questions. Thank you guys so much.
Thank you all so much. Dr. Queen Ginger, those presentations were absolutely amazing. I honestly didn't know the difference between food insecurity and hunger, and love some of the concepts that you guys introduced, like the food prescriptions and stuff like that, and the farmers markets taking SNAP. I mean, that sounds great as well. I don't see any questions in the chat, but I did have a question for you guys. So you mentioned a food desert. Does St. Tammany have any food deserts, and what does that look like?
There are. So anytime you're in a really rural area where you see, and I hate to throw this particular store under the bus, but Dollar General in the middle of nowhere, and it's the only game in town. It's there for a reason. They plan that intentionally, and they usually have a lot of that cheap junk food. There's not a lot of healthy stuff. So there'll be people that's all they can access. So if you go out to the more rural spread out areas, you'll see a lot of that. One example, if you're out on 190 in between Slidell and Lacombe, there's like 2 or 3. There's a ridiculous number of those, and that's all there is. And people can walk to them maybe, but that's the only kind of food that they might have access to, because they can't get down to the grocery store in Slidell or Lishman's and Lacombe, or in between Lacombe and Mandeville. So you'll see a lot of those out there. Also out near Folsom, I believe there's some in between. I think there's one in between up close to Bush too, if I'm trying to remember correctly. But when you get up north in those kinds of areas and you see a store like that, that's a pretty telltale sign.
Okay. So we do have some comments in the question and answer. Taffy wanted us to know that this was an awesome presentation and the resource was so helpful. Someone asked if they're going to get a copy of the slides. So yes, we are going to send that out. That will be sent to you via email. In a link to the recorded presentation. You'll have the slides, you'll have some other resource documents as well. Another comment about thank you for sharing. The information was amazing, and they look forward to sharing the recording and the resource information. So how can we get 211 cards to give to our employees? Do you guys know if that exists? Or
yeah, they do. And I know that Ann Pavlovich usually gets a lot of them. So I think that she would be a good contact. Also, we can send out information for Lavondra Dobbs with filing. She would absolutely be happy to give those out. And even though they're primarily based on the South Shore, she does live in Covington. So I'm sure that she would drop them off to a location. So we can absolutely get her information out there.
okay, so if you are the person who requested 211 cards, if you want to reach out to us individually, we'll make sure that that resource comes to you. All right. Thank you guys so much.
Thank you.
Y'all have a great day.
Thank you.
You too.